Hello, my name is Caitlin Boyles. I am a nursing student at Indiana State University in the LPN to BSN program. This is clinical video number 6 for Community Health Nursing 444, Communicable Diseases. Group A, streptococcal sore throat and scarlet fever. Additional information about this presentation. This presentation is geared towards parents and caregivers of young children. Although streptococcal sore throat can affect people of all ages. If you have not already done so, please pause this video and take a moment to take the pretest. The link is posted in the video description below. By the end of this presentation, you should be able to describe streptococcal sore throat, list symptoms of streptococcal sore throat, identify transmission of streptococcal sore throat, recall care for streptococcal sore throat, list complications of streptococcal sore throat, describe scarlet fever, and describe rheumatic fever. Streptococcal sore throat, Group A, commonly known as strep throat. Description. Strep throat is a bacterial infection that can make the throat feel sore and scratchy. Strep throat is most common in children, but it does affect people of all ages. I myself actually had strep throat within the last year. Symptoms include sudden onset of throat pain, painful swallowing, red or swollen tonsils, sometimes with white patches or streaks of pus, swollen tender lymph nodes in the neck, fever, headache, nausea or vomiting, especially in younger children, and body aches. Transmission. Strep throat is transmitted through direct contact with individuals who have strep throat or with individuals that are carriers of the streptococcal bacteria. It is also transmitted through large respiratory droplets. Communicability. A person with untreated strep can spread the disease for as long as he or she is symptomatic, which is generally 10 to 21 days. It should be known that many individuals are asymptomatic carriers of the streptococcal bacteria. They are not transmitters of this disease. Infected individuals can no longer transmit the infection if they have been on antibiotics for 24 to 48 hours. The incubation period for streptococcal sore throat is rarely longer than 1 to 3 days. Prevention. To prevent contracting strep throat, encourage frequent hand washing. Teach kids to cover coughs and sneezes, and teach children how to properly dispose of used tissues. To prevent transmitting strep throat, individuals with a sore throat or fever and children with an unexplained fever over 101 should seek medical care. You should call your doctor if you or your child has a sore throat accompanied by tender, swollen lymph glands, have a sore throat with a fever that lasts longer than 48 hours, has a sore throat accompanied by a rash, has difficulty breathing or swallowing. If you have been diagnosed with strep throat and have no improvement after taking antibiotics for 48 hours. Scarlet fever. Description. Scarlet fever is a bacterial illness that develops in some people who have strep throat. Scarlet fever features a bright red rash that covers most of the body. It is almost always accompanied by the sore throat and high fever. Scarlet fever is most common in children 5 to 15 years of age. Symptoms include a red rash. This rash looks like a sunburn, but it feels like sandpaper. It typically begins on the face or neck and spreads to the trunk, arms, and legs. The rash will turn pale if pressure is applied to the reddened skin. Red lines. Folds of the skin around the groin, armpit area, knee, and neck become deeper red than the surrounding rash. Face may appear flushed with a pale ring around the mouth. The tongue generally looks red and bumpy and is often covered with a white coating early on in the disease progression. The rash typically subsides in about a week. After this, the skin that is affected by the rash often peels and falls off. Causes. Scarlet fever is caused by the same type of bacteria that causes strep throat. In scarlet fever, the bacteria release a toxin that produces the rash and the reddened tongue. Complications. Rarely, scarlet fever can lead to rheumatic fever. Rheumatic fever is a serious condition that can affect the heart, joints, nervous system, and skin. Post-test and additional resources. Please take the time to take the post-test. The link is provided for you in the video description below. There is also a link provided in the video description below for a printable handout that accompanies this video presentation. References for this video presentation were the Center for Disease Control and Prevention for both scarlet fever and the Center for Disease Control and Prevention for strep throat. Also, the Communicable Disease Reference Guide for Schools, 2017 edition. Thank you for taking the time to view this presentation. I hope you have a wonderful day.